This is a typical run of what's going to be a cerebral angiogram. And the reason I say going to, because right now we just have imaging of the vessels in the neck. We see in this patient, this is the catheter. It's in the carotid artery. And there's the internal carotid artery and the external carotid artery and its branches. But this is the approach, and this is what we need to do to be able to see the blood vessels in the brain. It's all the higher we need to go when we're just taking pictures. If we need to do an intervention, meaning we need to do something to the blood vessels in the brain, we have special catheters that we can take all the way up into the brain and do that work. But that's not what we need to do here. So that's just, that's from the front and that's from the side. These pictures are taken simultaneously during an angiogram so that we can compare how the blood vessels look in 2 dimensions and get a better idea of, the turns and which blood vessel is which. So on this particular patient, on this side, on this angio, and it's a little hard to see because it can be blurry at times, but you can see the normal carotid comes up, and this is the brain filling, but right here we have this abnormality, right here and right here. This is it from the front, and this is it from the side, but then that abnormality is an aneurysm. And so that aneurysm is the one we're going to fix by placing a special stent, which is essentially a metal mesh tube inside of the artery to reconstruct the artery. And this particular stent is called a pipeline, and it's specially made to fix arteries in this location. And that's what we're planning on doing. So that's the run, and you can see, if we let it play, the contrast flows through the blood vessel and then out into the brain. But you can see it comes in and then it flows out, and these are all the blood vessels in the brain, which all look pretty normal. It's just this area right here that needs some attention. So on this particular patient, on this side, on this angio, and it's a little hard to see because it can be blurry at times, but you can see the normal carotid comes up, and this is the brain filling, but right here we have this abnormality, right here and right here. This is it from the front, and this is it from the side, but then that abnormality is an aneurysm. And so that aneurysm is the one we're going to fix by placing a special stent, which is essentially a metal mesh tube inside of the artery to reconstruct the artery. And this particular stent is called a pipeline, and it's specially made to fix arteries in this location. And that's what we're planning on doing. So that's the run, and you can see, if we let it play, the contrast flows through the blood vessel and then out into the brain. But you can see it comes in and then it flows out, and these are all the blood vessels in the brain, which all look pretty normal. It's just this area right here that needs some attention. But what an angiogram actually is we just need to get dye flowing in the blood flow to the blood vessels. The dye flows with the blood and kind of fills up the blood vessels, and then we take these essentially X-ray videos, and that shows the flow of the dye through. And that dye, because it flows with the blood, it shows us the caliber, the size, the shape, and the flow rate through the blood vessels, so that we can see if the blood vessels are normal in their size and their shape and their blood and their flow rate, or if there's any pathology like an aneurysm or AVM or some other kind of vascular or vessel abnormality. So that's what we're doing with the dye. And to get the dye, again, there's 4 blood vessels that supply the brain. There's 2 in the back and 2 in the front. The 2 in the back are called the vertebral arteries, and the 2 in the front are called the carotid arteries. And we select each one individually, one at a time. We inject the dye, it flows with the blood into the brain. We take the video and we see what the blood vessels look like, and then we move on to the next one. It's an invisible dye essentially that we inject through the catheter. It's radio opaque, meaning it shows up on X-ray, but it just looks like clear liquid if you were to look at it, in a cup or something on the table. So, but it's specially made to go inside of the blood vessels. It doesn't hurt the blood vessels. It doesn't hurt the patients, and then, it gets metabolized and excreted. The catheter's entry point is at a large vessel on the top of the leg, and then that catheter goes up through that blood vessel. But yeah, it's a large blood vessel at the top of the leg, and we can also go through, arteries in the wrist. That's the approach. And then the catheter is a very small tube, specially designed to go through the blood vessels. We guide the catheter, the tube, over a small wire to direct it where we want it to go. We pick the blood vessel we want it to be, and we take the wire out. And the blood vessel, the catheter sits inside of the blood vessel, and then we inject the dye into the tube of the catheter, and it flows out and is distributed into the blood flow where the catheter tip is, and then it flows up to where we want. And that's where we take the X-ray pictures, and that's what we see. We see what the blood vessels look like, what's going on, and if we need to fix anything. And if we need to, we use the same technique, and we go up with another catheter into whatever's wrong, and we fix it. You can be majority of patients, if we're doing work, they are asleep. But if you are, you can be awake for angiograms. If you're just doing angiograms where you're taking a picture, it does not hurt. The dye flowing through gives a sensation of warmth, but it doesn't hurt. And then you can be, it just makes it easier for the if there's an anesthesia risk or something like that, you can do these awake if need be. But most people prefer to be asleep just because they, just the nerves and just easier. And that's cerebral angiograms. And this is what we do. Basically what happens is there'll be, like on this angio, let's pause it right here. So there'll be a blood clot will form somewhere else in the body, maybe the heart, maybe somewhere else, but somehow it flows up. There can be a bunch of different reasons, but it flows up and can get into the brain. And patients will have an acute stroke where something will stop working. They'll have weakness on one side or slurred speech or inability. So then we get a special CAT scan. We'll see that there's no blood flow because there's a blood clot that flowed all the way up, got clogged right here. No blood flow there, so we have to go up. So we have special catheters that we can go and take all the way up and engage that blood clot. We can either put a special grabber, it's called a stent retriever, inside of the blood clot and pull it out, or we can go up with a special catheter that is designed to form a vacuum and suck the clot and either pull it out or suck it all the way out, but not collapse under the vacuum's, under the vacuum's force. But anyway, either way, we can go up and try to engage that clot and pull it all out and reestablish blood flow. And that's something that we do often. It's an emergency. Time is brain. So when patients have this anywhere in the state, they can go to one of the centers that we cover and they either get flown in or ambulanced in, but it's an emergency. We go there right when they get there. We go up with the catheters and try to retrieve things. We've had a lot of really, really good results. So that's one of the emergent things we do during by using the endovascular angiography technique. The arteries are more robust. They've got muscle in them, and they carry the blood flow from the heart under pressure up to tissue. Pushes, it's just like electricity or like plumbing. It pushes under pressure through the diffuser, which is the tissue, through all the small pipes, and then the low pressure is the veins that recollects the blood and takes it back to the heart. Those vessels are, on their return back to the heart, they're not very robust. They don't have a lot of muscle in them, so they can't withstand the pressure. We can do venous angiograms, but you're going retrograde against the blood flow. When you're going, with this way, you're going anyway above the heart. You're going with the blood flow up into the brain. So, but the primarily what we do is on the arterial side, because aneurysms are on the arterial side, fistulas, all those things are primarily on the arterial side. So that's why it's an arteriogram. But every once in a while we will get to the venous portion. But like right here, this one. So this is the flow in the artery, right? So this is normal blood flow. It goes out into the brain, and you don't really see it. Now it's recollecting in the venous system. This is the venous return going back to the heart. So this is artery phase, tissue phase. Starting to recollect, this is the venous phase going back to the heart down. So, and you can see the different lobes of the brain. You can see from the left side primarily feeds the left side, not the right side of the brain. And you can see if I zoomed out, you would see that this is the anterior, so it's the left front. You don't really see any of the left posterior because that comes from those vertebral arteries in the back. They all have communication between them, but they the communication is kind of separate.